On this edition of Being Well, we welcome Susan Hayes, registered nurse from the Douglas County Health Department. Our discussion will center around vaccines. We'll learn more about how vaccine schedules are determined and who sets the standard for what vaccines children need for entry into school. We'll also get into the most common vaccine questions and misconceptions. That's all just ahead on this edition of Being Well. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. Welcome back to this edition of Being Well. I'm your host, Lori Banks, and today I'm so happy to have a new guest on the show. Susan Hayes, who's the Director of Nursing for Douglas County Health, is here. Thanks for coming to the show.
Well, thanks for having me.
Tell us a little bit about yourself and what you do at the health department.
Well, I'm the Director of Nursing at Douglas County Health Department. It is a small health department. We're a small county. So I oversee the programs of the nursing division of the health department, but I also work within the programs of the nursing division.
Okay. Well, one of the things I think people think about the health department for is vaccines, immunizations, shots. They're all really the same thing. How did those vaccines work to prevent illness?
How do they work? Well, that's a really big question. And we need a scientist to answer that. But basically, in a nutshell, what vaccines do is they take your body and it's like infecting it with a little bit of that illness and having your immune system respond to it. And then the immune system then says, hey, I've seen that before, I know what it's all about, and I'm going to take care of it before it becomes a problem for you.
So if you get a vaccine for something, does that mean you can never get that illness?
No. There's never in anything. Being vaccinated decreases your chances greatly of getting an illness, but it doesn't mean that you will never get it.
Okay. So people who say, well, I got the flu shot and I got the flu anyway, it could have actually been a different strain of flu.
It could have been, or maybe it wasn't the flu. Because sometimes people perceive as being the flu isn't the actual flu that we're vaccinating against.
All right. Well, as long as we're talking about flu, that seems to be the thing that probably most people come in contact with, and that's the flu vaccine. How does how figures out, well, this is the kind of flu we're going to have. We're going to mix up this kind of vaccine for this year. How does that work?
Well, there's in excess of 100 national flu centers around the nation, everywhere. And they follow the flu strains, the flu activity worldwide all year long. And they feed the data into one of the World Health Organization sites. In the United States, it's in Atlanta, Georgia, with the Center for Disease Control. That data gets fed into it, and then really smart people take a look at that data and in February make a decision on what strains they think will be prevalent for the following flu season. Because think about this, in February, we're still in the flu season. So they're looking into the next year. Okay.
So sometimes they don't hit the mark, which happened in 2014. Is that correct?
Sometimes they don't hit the mark. In fact, if you go back to the H1N1 flu season, that's a perfect example of when we had this antigenic shift of flu, and all of a sudden we had this really nasty flu that reared its ugly head and said, hey, I'm here and I'm going to hurt some people. And at that point, then the vaccine manufacturers went, let's get busy, let's manufacture a strain. Now, they don't always do an additional flu shot. It depends on how serious that additional flu strain is. But you're right, in 2014 we had a strain that wasn't in there that ended up kind of making some people sick.
So you hear this, especially when flu shot season comes up, and people will say, well, I got the flu shot and then I got the flu. What's happening with that?
Well, let me explain. The flu shot's an inactivated virus, so it can't make you sick with the flu.
Okay.
But what happens is when you get an immunization, your immune system is stimulated to work. And so sometimes what people perceive as being a reaction to the flu shot, i.e. flu, is not really the flu. So you get a flu shot, and occasionally people, and it's not real common, will have some body aches after, or maybe a little tiredness for a day or two after. That's your immune system responding and working, making that,
doing what it's
supposed to do. Exactly. If you get the full-fledged flu a couple of days after you got the flu shot, it's not because the flu shot didn't work, it's because you didn't get the flu shot soon enough. It takes about a week to 2 weeks for the flu shot to stimulate your immune system, for it to actually prevent the flu. So you were exposed, you got it, and unfortunately it wasn't soon enough.
I've noticed this too. Some years the flu shot, I have more pain in my shoulders, and then some years not.
Yeah.
So what is that about?
Well, it's a different formulation each year, and vaccines are different formulations. So some can cause a little more discomfort than others, but here's my advice to everybody. Sometimes it has to do with the way we feel or think about something. And if you're tense about that shot, or if you're tense about life in general that day, when you tense up your muscle, it's more difficult to put that vaccine into your arm, and you'll feel it more. So if you can relax your arm when you take your shot, even for those ones that might hurt a little bit more, it's going to hurt less.
How come some vaccines are given in different places than others? I think that's another common question. Why is it here and not here?
Well, it's based on all of the studies that they did on how well the vaccine performs being given in the muscle as compared to being given in the subcutaneous tissue, as being given in an oral form or in an intranasal form. How does it work the best? And that's the form that it is given in.
Let's talk a little bit about the most common vaccines that you're administering at your department.
We administer all of the childhood vaccines that are on the recommended schedule. And when you say common, we commonly administer them all. We probably do on average about 150 vaccinations a month. So we do a lot of shots, and it's all the stuff that we have. With the adult vaccines, it's a little different for us because we're a small health department. We don't see as many travelers, so we don't always carry travel vaccines, some of the more obscure travel vaccines, but we do carry a lot of the adult vaccines also.
I want to get into this, you called it a schedule of childhood vaccines. Who decides what a child needs? Because I know for parents out there, it seems like, wow, this is a lot, and it seems to be more than it used to be.
The decision is based on a bunch of, once again, smart people. The ACIP, which is the Advisory Committee on Immunization Practices, set the standards for what we should vaccinate here in this country. The Center for Disease Control also publishes that information for us all, and it has changed over the years.
And what have you seen in your time in public health? What have been some of the biggest changes?
Vaccinations? Well, vaccinations, like medical care, is always changing. There's always different changes. We get new vaccines. We have vaccines that are changed. We have medical care that's changed because it's not a stagnant thing. Medical care isn't stagnant, and it never will be. The reason things change so much is because we want to keep the population as healthy as possible, and we figure out new ways to do that. So some of the more recent changes in vaccines, we've added to the schedule some vaccines like the HPV vaccine. The meningitis vaccine is now on the schedule since I've been there. We have a lot more combination vaccines. That means more than one in a shot so that it's easier to administer and easier for someone to take. So some of those things are things that I've seen over the 15 years I've been there.
All right, this is a common question you get. We want to talk about exemptions for vaccinations because that has been in the news, talked about it a lot. Kind of set up how that works, and is it the same from state to state?
Well, no, it's not. We all do things a little differently. You can have one of three exemptions going into school. A medical exemption, which anyone is going to accept, and that means that you medically cannot have that vaccine for some reason. Religious exemption or a philosophical exemption. There are a number of states that allow all three of those.
Okay.
There are, most of the states, if you look at the average, allow for a religious and medical exemption, and there is one state now, as of the last year, that allows only for a medical exemption, and that's California.
Okay, what does Illinois have?
Illinois has the religious and the medical exemption. So if you don't want to vaccinate your kids, it would fall underneath a physician saying medically that child cannot have that vaccine, or you have to go through a process to claim a religious exemption.
So are there more people not getting their kids vaccinated in your practice? Is that what you're seeing?
I wouldn't say that we're having more people not giving their kids vaccinated. I would say there's been a little bit of a shift. And what we're seeing is people that are questioning vaccines are, instead of, used to be that it was folks that really didn't know anything about vaccines, and now it's people that are accessing the internet, which is wonderful. We all love it for great things. And they're pulling information off the internet, but it may not be a good site that is giving valid, accurate information about immunizations. And if you don't know where to go, some of these sites are great. I mean, they look wonderful, they look very professional, and they look like they know what they're doing, but it's often not accurate information. And so there's a little bit of maybe a fear in there for parents that the vaccine is going to harm the child or cause issues.
So if someone here in the state of Illinois wants to file an exemption, it's a little more involved than just filling out a piece of paper.
That changed this year, and the reason that it changed this year is simply because that, you know, we're starting to see some outbreaks in certain vaccine preventable diseases because we're not having enough vaccination done or other issues, and that puts us all at risk for illnesses. And the general thought is that people may not be well educated on vaccines and really understand the importance and why they're there. And so now, in order to claim a religious exemption, you have to take a form to your doctor. The doctor is then responsible for educating you, discussing the benefits of vaccines, and then he can then decide to sign the form for you, and then you can take it to the school.
Okay, so it's a little more involved.
It's a little more involved. It makes you think more about vaccines. And
is that just here in the state of Illinois, or are more states kind of making the process a little more education-based?
Yeah, and yes, it's in the state of Illinois, and some other states are also coming on board. California is a perfect example. They'll no longer accept anything but a medical exemption where the physician says this child cannot have this vaccine for XYZ reasons.
Okay, let's talk about outbreaks, because in the fall of 2015, specifically on EIU's campus, we had outbreaks of mumps, which we haven't heard of that in a long time. And we've heard in other years outbreaks of measles. Why is that happening?
Okay, there are a number of different reasons for that. Let's start with the fact that we just identified that some people are not getting vaccinated. And if you're not vaccinated, you're at risk to pick up illnesses. We are a very mobile society now. We don't just stay on the farm like we used to. We travel, and we have international travelers, and especially on your Eastern campus or the University of Illinois or any of the other campuses, you have people from all different countries coming in that can be coming in with certain things, even though we may not see as much of it here. So part of it is the fact that some people are choosing not to vaccinate. Vaccines require a certain number of immunizations to get a good efficacy. So if you had a measles vaccine and you didn't get the second one, that's another reason why you could potentially come down with it. Measles, mumps, rubella is a combination vaccine.
The MMR.
It's the MMR, correct.
Common.
So you got the first one, and for mumps, it's going to give you about a 78% effectiveness, and you were exposed. And you fell in that group of folks that didn't get a good uptake on it, and you could get it in that way. Another way that you can get it is you've had all your vaccinations, but for some reason your immune system is compromised. You're depressed because you have an illness or because you're elderly. The older we get, the less effective our immune system works. So you end up with simply an immune system that says, hey, I had those shots, or I've been exposed, and whoa, here it came back and I'm not going to work well for you. So there's a number of different reasons that that can occur.
Okay, so it's not just one.
Not just one.
So you talked about what I remember, they're booster shots. Which ones should you be getting that second shot of the booster shot?
Okay, all of them are a little bit different. So some vaccines require 2 shots. Some vaccines, like your yearly flu, it's just 1. Some vaccines have 3, some have 4. Some get a booster every 10 years, that's your tetanus booster. It really varies vaccine to vaccine.
Okay. And that is something, and this is always hard when you go to the doctor, especially if you maybe don't keep track of that. I don't remember when I had what. So what do you recommend for, let's get into adults, what, vaccines for adults, and remembering what I need when.
What do I need? Well, it can be a little complicated. That's why you want to rely on your doctor to help you out with that, or your health department. But with your adults, as long as you've had your primary series of childhood vaccines and kept up with that, the things that you want to remember, your tetanus booster, you want to be sure and get that. And you want to have a Tdap if you haven't had it, which has the pertussis or whooping cough component in it. Because we can, as adults, get whooping cough and pass it on to other people. For us, it's an annoyance. If you're a normal, healthy person, it's called the 100-day cough for a reason, because you will cough your head off for 100 days. But for an infant or a young child, it can hospitalize them and it can actually kill them. So you want to be sure and get that, especially if you have young kids or you're around anyone that is elderly that can end up hospitalized for something like that.
All right. What about, we see now shots for shingles as older adults, and pneumonia and other things.
Okay, so the pneumonia shot, once you get to be a certain age, and your doctor's going to let you know about that, but it depends on your health status. You might get it younger, you might not need it until you're 60 or older. There are 2 vaccines out there, and your doctor will tell you whether you need one or both vaccines, but they help prevent bacterial pneumonia, which hospitalizes a lot of our elderly or immunocompromised population, and people die from that. So it's important to get that. The shingles vaccine is a really important vaccine also to get, because it's for people 65 and older, and they have been exposed or had chicken pox. So that means that can reactivate later in life, when their immune system is compromised, into shingles, which is a miserable thing to have. So yeah, a little poke is worth it for those.
Yes, I've had shingles before, and it's awful. I would not want it again. I have said, can I get the vaccine? Like, you got to wait about 15, 20 more years for it.
Exactly.
What about when you're traveling outside of the U.S.? I know you said in your department you don't have a lot of international people who are traveling internationally. But that is something, you need to think about, that maybe people don't. I'm going to go on this African safari, that I might need some special vaccines for that.
That is something you really want to think about, because certain countries that you go to, you don't need to do anything in addition to what you're doing here. But certain countries that you go to, you want to be sure and protect yourself. And my suggestion is, if you know that you're going to travel outside of the country, make plans at least a month or well in advance, because you are going to need to look or have someone look at your vaccine schedule. What have you had? What needs to be filled in? And you need to have time to get those immunizations before you leave. So call your doctor's office if they are good at that. Most health departments have like a travel clinic where they can at least tell you or send you in the right direction on where to get those travel shots.
Okay.
And then some places also have travel clinics for that specific reason.
Okay. In these last few minutes, let's talk just a little bit about, I want to get back to this flu shot, and I think I might know the answer to it, but I want to ask you, who should be getting the flu shot?
It's recommended that anyone 6 months of age and older get the flu shot. And I'm glad that you asked that question, because I want to talk a little bit about something. And the reason for that recommendation is, and I hear this all the time, I'm young, I'm healthy, I never get the flu, I don't need it. Well, you're not getting this flu shot for you, maybe, per se. You're getting it for people you come in contact with. That is called herd immunity. When we vaccinate enough people, we vaccinate the entire population, and we protect those people with the depressed immune systems. We protect those people that can't get the shot. We protect those babies that are 6 months or younger that can't get that immunization. And so we're doing it for the herd. And so when you're thinking about me, I don't want it because I don't need it, I want you to think about your elderly grandmother, or the young baby that you might come in contact with, or this cousin that has certain illnesses going on that make them, or an aunt that has cancer. You're protecting all those people, friends, family, in the community from that.
And I think sometimes you need to look at your, if you work, what's your work environment like? Here where we are, we tend to type on other people's computers, and we're in close contact. So if you kind of work in that, maybe an office environment where if one person gets it, they all get it, it may not be a bad idea either. Or if you're a school teacher or teaching college students,
absolutely,
think about the other people that you're around who you may.
Absolutely. And if you're in healthcare of any kind, do it for your patients.
What about advice do you have for people that just absolutely have that fear of the shot? How can we reduce the shot anxiety?
It happens. I mean, it happens. We all have that. My suggestion is that I want them to understand that the needles that we use are so fine and tiny anymore, you really don't even hardly feel those going in. What you may feel is a little bit of the injection going in. If you relax yourself as much as you possibly can, it's going to be minimal discomfort for you. And sit down, go to your happy place. It'll all be fine. It will.
But there are some vaccines that just because of what you're getting, the needle just has to be bigger. Is that true?
The needle size is based on most vaccines that we give, is based on not the bevel, the size of the needle around, but on the length.
Okay.
So it's the same size around, it's the same, I guess, thickness. It's just a little longer because it needs to go into the muscle as compared to the subcutaneous tissue. So it looks like it's bigger, but it's actually the same width.
So if you haven't had a shot in a while, if you haven't had one in 20 years, it has actually gotten better.
Oh, the improvements over the years with vaccine is huge.
Yes.
It's really huge.
And I think, you brought up, when we were talking about this on the phone, there was a time in our history when polio came out, and that was, for that generation of people, that was a life-saving thing. And I think historically we've kind of forgotten about vaccines. Have kind of gotten sort of a bad rep. Right. We've kind of forgotten that at one point it was saving people's lives.
Absolutely.
And how important it was.
Well, if you look at polio, but if you look at the measles, mumps, rubella vaccine, that wasn't developed until 1962. And before it was developed, 500,000 cases of measles a year when that vaccine came out. And of those 500,000 cases, 150,000 would have severe respiratory complications. 4,000 people would die from that. I mean, it's not acceptable in the United States for 4,000 people to die of anything anymore. Right. And it's preventable by a simple vaccine.
So I think we will leave it at that. Thank you so much for coming on and shedding some light on vaccines and providing us with some great information.
Thank you for having me.
Thanks.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles. Eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.